All right, so there might be some people popping in like throughout. I don't
Okay.
know. Mondays are weird days for everybody now, it seems. Like Thursdays seem to be better. I don't know. It always changes. You know, Autism Mom Probs, we have like a million appointments. It's kind of crazy, but at least we have the recording so we can make sure everybody gets their hands on this. Dr. Tay, you guys, if you were here this time, well, it wasn't this time last year, or was it? Yeah, it was about summer-ish time we talked to you, I think. Um, I think Lisa and Jesse were, but Jody and Cheryl, I don't think you guys were. Anyway, Dr. Tay is a child psychologist, and do you work with adults?
Just
No,
kids.
just kids. Okay.
Yeah.
Anyways, she's going to be talking about family dynamic tonight, and because our Zoom call caps out, I think at 30 minutes tonight, I'm going to let her take the floor, and I'm not going to waste much time. But welcome, and so stoked to hear from you, girl. Thanks for popping in.
Of course, I'm happy to be here. And I'll keep this pretty informal. I mean, I have a couple things that I just thought I would share to kick us off, but then totally open to questions, whatever would be most helpful. So, we kind of decided we would talk a little bit more about the family support side of it. And what in my practice have coined as the whole family approach. And so, a little background about me. I actually grew up with an autistic sibling. So my brother is 10 years younger than me. So I was 12 when he was diagnosed. He actually got diagnosed at 23 months of age. And I would say our like lives completely, had to shift in the way that we were doing things. So he was in about 45 hours of therapy a week in our home. And I went from being an only child to having this brother and then having a brother with, much greater support needs. And so one of the things that I found, as I was growing up is that the therapeutic services were really focused on what my brother needed, and there wasn't a lot of support for my parents and then in turn for me, and they didn't necessarily know how to navigate this either. And so what was interesting, obviously that shaped me into becoming, a psychologist, getting into the field. But what was always so striking to me is how much we still really aren't talking about the family support aspect, that a lot of the therapeutic supports are really focused on the autistic child themselves. And so when I decided to launch my practice, it's almost 2 years ago, I was like, this feels like a very important piece to me, is that we're actually talking about this and navigating this. And so one of the things that I really focus on in my practice is giving space to talk with parents about what they're navigating, as well as, talking about siblings, too, and knowing how best to support them through this journey. And so I think the biggest piece, there's lots of different ways that I come at this and that I ultimately end up supporting families. But I think one of the things that we have a decent amount of moms with multiples. Yeah, absolutely. And even if too you have like multiple autistic children, a lot of times their support needs are very different too, right? That it's not like you can take one approach and it feels like it fits perfectly for both of them. And so that can be some of the challenging piece. And so this kind of leads me into something that I talk with families a lot about. And some of you guys may have already, through social media started to discover some of this on your own, but is truly understanding your own neurodiversity in this, how your brain is uniquely wired. And I think that, I see parents going on this journey in a few different ways, actually potentially going through an autism evaluation themselves, or evaluations for ADHD or anxiety or depression, and learning how to support that mental health piece. But one of the things, I do want to share is going on that journey can be really helpful, whether you do that through a more formal process or you're doing it in more of a, self-discovery type of way. And here's the reason why I think this is so important. I'm going to give you a few. is number one is I think it's super important when we're trying to make decisions, for the child that we're thinking about parental capacity in this. And so a lot of, care and a lot of approaches are more, right? You constantly maybe are being told by teams you have to do this therapy and adding and layering. And one of the things that I find it doesn't often take into account is what the family's capacity is, whether that's your own capacity as a parent, or it's also like thinking about balancing other people's needs in the family. And so I think that capacity in terms of what you say yes to is super important. And a lot of times you won't hear this from providers, but I really I'd invite you to give yourself permission to say no to things, and to say no to things in not a way then that you're constantly beating yourself up of, should I have done that? Was that the right decision? Because you can always go back and say, okay, it's not, I love this idea of yet or not right now, right? Like you can say no to an additional, maybe occupational therapy and adding that on in an outpatient setting. And while, yes, it could be beneficial for your child, it might not be the right timing right now. And I think a lot of times we just hear, well, yeah, that's what you should do. But there's all these moving pieces in this. And so I think thinking of your own capacity, the other piece that I want you to really think about in terms of the way your brain is wired is, are some of the approaches that you're being taught, are they in harmony with how your brain works, or are they, incongruent with how your brain works? And not being afraid to advocate, as you're navigating with the school team and the therapy team, to be able to say like, listen, that isn't realistic for me. And so a great example of this is, like, for example, I will hear families talk about that sometimes, like adding more like structure into their schedule, right? It's like, okay, you need to be predictable. You need to have a routine schedule. You need to make sure you're following this. And that I've heard parents say, like, my brain does not work like that. And so while it may benefit your child, if your brain doesn't work like that, I want you to think about the cascading effect that happens, right? So some provider says, I want you to have this set schedule. And you're like, okay, sounds good. I'm going to do that. And then what happens from there? You go home, you try it for a day or two, you're trying your best, you're trying to stick to it, and then life happens and all of a sudden it goes away, right? Then, as a result of this, and this is just one example, but then you have the guilt and the shame that gets stirred up as a result of that. Of, oh, I'm supposed to be doing this. Why can't I do this? What's wrong with me as a mom? Why can't I figure this out? Every other parent figures this out. I'm failing my child. All these kind of I love Lisa said she doesn't function on a schedule. Yeah. And so it's knowing and owning that, but also not being afraid to tell your providers that you're working with, and saying, listen, like, I know myself, this isn't going to work. What is something that maybe could benefit my child, but also works the way that I do? Because if we get into this tailspin of what we call catastrophization, I promise you, it's affecting more than just not having a schedule. It's actually potentially, by putting the pressure on yourself to have a schedule, it actually might be creating more challenges and more potential kind of disruption in your family than just not saying, like, from the get-go, than saying, no, I can't do this. I don't have the capacity to do this right now. Because one of the things is, it's impacting your own mental health. But what I find about most autistic children, they are, and it's interesting, we talk about emotional capacity and emotion and empathy a lot, but I find a lot of autistic kids are super sensors, where they know when you are stressed out, when they know if you are overwhelmed. And so this is one of those things, is then all of a sudden they're feeling this stress and this energy, versus if from the get-go we had just said, no, that's not going to work. And I think as parents, sometimes our systems don't empower you to feel like you can be your child's best advocate in this, that the professionals know better, the school team knows better, all these different providers, the medical team, the doctors, everyone's coming in as the quote unquote expert in this. And I think that that is something that I really encourage you to take a step back and realize, like, you're the expert of your child. No one on their team is. They all might be experts. Like I always say, like, okay, yeah, I have expertise in early child development, for example, or I have expertise in understanding autism and navigating it from this clinical lens, right? But I'm not the expert of your child. And and even if you work with me, even like I have a family right now I've been working with for almost 2 years. I know so much about this child, but I still am not the expert of that child. The parents are. So anyway, I can go on soapboxes about a lot of different things. So let me come back to my main point is it has this cascading effect when you're not thinking of your own capacity in this. And so what I invite you to do is doing some self-exploration of actually asking yourself, what is going to work for me as likely my guess is the primary caregiver, and what is going to work for my family. And so sometimes too, on the sibling side, that might be saying no because maybe another one of your kids has soccer practice at the same time that therapy slot is. And it's easy to go to, well, I have to do the therapy, but we also don't think about sometimes what other kind of life circumstances add accumulatively to your child's experience, right? They need to live outside of the therapy room. They can't just be in therapy this whole time either. And so making decisions from that place of understanding how your brain is wired, how your other kids' brains are wired, because it might be, okay, you say no to soccer, but then is every night your other kid having a meltdown because their sensory system doesn't feel regulated enough because they didn't get that stimulation? Well, that impacts your whole family. That impacts your autistic child. And so this is why I think it's so important to sometimes just take a pause and say, I need to think about this. I need to put the moving pieces together. And I'll kind of pause here because I don't want this to be like I'm just ranting at you guys, but I want you to give yourself permission to explore how your brain is wired, how everyone else's in your family's brains are wired, and thinking about what are the best ways to create harmony with that. And it's not going to be easy. It's not going to be perfect. There's going to be times where it absolutely feels like there's competing demands and that there's no way to fix that solution. But I also encourage you to realize, like, you're doing the best that you can with the capacity that you have and the circumstances that you have. And so sometimes that means, things aren't going to run optimally, but also realizing that that doesn't mean you have to take on all the burden of things not working optimally, and just taking a step back and realizing, I know this doesn't feel the most hopeful, but I also have worked with parents of autistic kids a lot to know, like, our systems are failing your children, our systems are failing your family as a whole. And so you can't take on the burden all the time of the systems that aren't working optimally. And so sometimes it's just like, it's hard right now, and there's nothing that I can do right now to fix this, and that's okay. The thing that your child needs the most, I can tell you this, research has shown this, I've seen this in my clinical practice, what they need the most is a parent who's going to love and support them and be there for them, even through the really, really hard times when it feels like you can't fix anything else. So I'll pause there. I'd love to hear if there's any questions. Yeah, like Brittany said, Tegan only eats new foods with Lance because of sensing my anxiety, right? And so let me just real quick though, reflect that. That's a great, understanding, Brittany, and I know you know a lot about your own neurodiversity in this and how your brain is wired, but recognizing like sometimes the best thing you can do for your kid is realize you don't have the capacity. And this is where tag teaming is super, super helpful, or asking people for help, or, like realizing, okay, I have a lot of anxiety around this. Maybe I'm not the best one to implement this right now. And some of that is twofold, right? It's one, knowing your limitations, knowing your capacity, but then it's also an invitation for you to keep working on getting to know yourself. How do you self-soothe yourself and building up that capacity? So over time, this might become something that in the future it is possible to navigate, right? But it's okay that it's not possible to navigate right now. We can't change everything at once. And so, what I invite you to do is think about what are the things that are the highest values and priorities for my family right now, and prioritizing those. And whether that's, some tag teaming, or just saying, like, a great example that I hear a lot is like, and it's well intentioned, but like occupational therapists being like, okay, we need to work on holding a spoon or a fork, right? And I'm like, okay. I literally had a family of a 3-year-old. That was something the OT said. And I went back to the mom and I said, where does that fall in terms of importance for you? What are your goals right now? And she's like, well, I really care about figuring out ways to communicate with him, that I understand what his needs are. And I said, okay, that's what sounds like the priority right now. And so it was going back to the OT and saying, yeah, that's not in line with the family's values and the way that they want to move right now. But it doesn't mean that this kid is never going to learn how to hold a spoon or fork. He actually does know how now, but that we focused on the communication piece, building that up, and that actually helped some of these other goals as a result. So it's okay to say, it's not a goal right now. What are some of the things that you can help within this realm of therapy?
I didn't realize until we're having this conversation now how, I mean, essentially, I did this without knowing, but I did and have let the guilt over choosing to not do feeding therapy earlier on because of how significant of meltdowns we were experiencing, like throughout the day after that. Like, I could not deal with it. Neither myself or Tegan, we were just not our best
Yeah.
selves. So we're just like, ABA, after me like pushing it off and pushing it off and pushing it off, finally decided to like go the more like gentle route that I had like wanted from the beginning. And I mean, it's very slow progress, right? Like he's just like looking at food at this point, but like that's better to me, in my opinion, than like making him hate all food because he's so terrified of it every time like someone's like, let's try something new, you know what I mean? So anyways,
Absolutely.
it did eat me up for a while because I feel like he could be so much further along than he is, but this is just a great reminder for me that like listening to my gut was fine and not kicking
No,
my ass over it,
I definitely needed to hear all of this too, because like aside the routine thing that really hit hard because I recently was at a group meeting for local autism moms and they had like an ABA therapist come from obviously like way out of town. We're rural, so we don't
Mhm.
have ABA therapy here at all. And they
Yeah.
hit on that a lot. Like you have to have this kind of structure and schedule, and it needs to look like XYZ so that it can be okay at school. And so obviously the guilt sets in. And then it's a larger level of guilt because I've also had to weigh our only alternative in order to get him to those types of therapies is literally to move away.
Mhm.
And doing that would mean I have no support from my family. I'm currently a stay-at-home mom for our youngest child. So do I have to go to work and then send her to daycare? And then I'm not as available and present to be doing these things at home with them anyway. So it's just a lot of weighing like what is going to really work for our family. And I've been going through this cycle for the last couple of, well, really since he was diagnosed like 3 or 4 years ago now. And it has been such a process finding a place where I'm not going to continue beating myself up for the position that we're in and making the decision that works for us right now, and knowing that I'm doing my best. And he has made so much progress. Like, he went from being completely nonverbal 2 years ago, and without any ABA, now he says many, many words and phrases. He signs please and thank you for things. Like, he knows how to ask for food and to get his basic needs met. He tells us he loves us. I'm like, 2 years ago, I didn't know any of that was possible. And I thought that I was the reason that it wasn't going to happen, because I didn't make that sacrifice and do something that may have really just been detrimental for all of us. And me with my own neurodivergence and hella anxiety, it probably would have been really bad for me to leave all of my support and the place that I know and I'm comfortable with. So
It sounds like it.
this was so validating. That was a long story just to say
Good.
I needed
Good.
all of
Well, and I do want to point out for both of you, I think it's so easy too. The guilt and shame makes us think that the decision of opting in would have been this like dream-like process, right? You're listening to your gut, but then our brain, especially like the left side of our brain, is a predictive machine. It tries to predict what things would be like, but it doesn't always have all the data.
That
And
part
so-
of my brain needs to sit the F down.
Exactly. And so sometimes too, it's easy to be like, oh, well, we could be so much further along if. The thing that we know about kids is in order for them to learn, they have to be both regulated and engaged. Those factors are essential in order to make progress. And so what I'm hearing from both of you is that regulation wouldn't have been there for different reasons, right? Whether that's a direct, like it's too distressing right now and we don't have the coping skills to be able to navigate feeding therapy, or it's like, okay, you move away, life changes, which is that uncertainty is going to create more stress. But then also, you know, for Jesse, you're saying like your hella anxiety too, then your kid's sensing all of that. And so I do also, when you find yourself feeling the guilt, what I recommend is really just saying, this is going to feel super weird, but I promise it works. Just saying, hello, guilt. Okay. Yeah, I see you there. Thanks for letting me know. I have some other pieces in the mix right now. I got this, but I'm listening. Thanks for letting me know. Let me know if I need to know anything else important, because the guilt is communicating something to you. We don't need to like push it down. We don't need to suppress it and pretend it's not there. That's not going to serve us either. But just because that emotion pops up doesn't mean we have to respond to that emotion. We can acknowledge it and let it be there. Yeah. And like, just acknowledging it. It's here. It's with me. But I don't need to take action as a result of all of this too. And there's a reason when you come back to that gut and intuition that you made that decision. And listen, at some point, if you decide you made the wrong decision, then you pivot at that point, right? If it's like, you know, maybe I should have done this. Let's check back in with ourselves. And so you're not making any permanent decisions, I think is important to remember.
That is so helpful. Like, I need that tattooed on my forearm. Like, seriously, anytime I have like a really like freak out moment, Lance is really good at talking me off a ledge, and that's basically like moral of the story every time. Like, this is not forever. Like, you know, we can pivot. We can definitely pivot. And I just have to say this real quick. What is that movie with all the different emotions?
Inside Out.
Inside Out.
Okay. Imagine an autism mom brain version of that. One of them would be guilt. I was just like, why was there not guilt? Oh, because she's a little girl. She probably didn't like have that yet. But I'm just thinking.
For real. So one of my favorite books, I actually was going to mention this, kind of maps on to Inside Out, but is obviously a more adult version. So this is a book not about autism, not about your parenting journey. It's a book for your own emotional processing. It's called No Bad Parts by Dr. Dick Schwartz. It's based on a type of therapy called internal family systems. And some of what I just said to you about just saying hello to your guilt, it's a part of you, right? And sometimes what happens is these parts get super loud and want to take over because they've been used to having that role in your life. And at some point, that probably served you, especially when we're younger. They often serve us, but then there's ways that it ends up sabotaging us too. And so understanding that there's all these parts that are trying to have their voice heard. And I often like to think of these little parts as a child, right? Where the best thing we know for your child when they're dysregulated and is to get down to their level and just validate what they're experiencing, being with them in that moment. And so this is true of all emotions. How can you imagine it being, one of these characters from Inside Out or a child and just kneeling down and saying, I see you, I'm here with you. I've got this as the adult, which is your whole body coming together. I've got this right now. And so that book, I'll be really candid. I work with a therapist myself who does internal family systems, and that's how I learned about the book. And it's been transformational in, my own emotional processing journey, because I learned from a really young age how to be a helper and a fixer. And I was really, really good at it. And that's why I'm in the field that I'm in. And that's ways that it serves me is in my professional life. But there's things in my personal life being a helper and fixer doesn't serve me. And so learning to kind of process through all of that. So highly, highly recommend that book. It's deep though. It's gonna challenge you and kind of take you to that next level. But I think understanding how to recognize some of this can be a really essential but often missing part, I think, in the autism journey.
Almost definitely, my God.
Yeah.
Going through therapy and getting my diagnosis and all that has made a huge difference. I feel like 2 years ago I'm just a completely different person. Just
Mhm.
it's so helpful
It
knowing,
is.
what you need to work on and working on it. So if y'all aren't in therapy, do it.
Mhm.
Get after it. I'm a big advocate for that. Um, what was I gonna ask? Oh, tell us where can we find you? And also, are you practicing in Michigan? Are you in Michigan?
Mhm.
Okay, because that's good to know because obviously we're coming back to Michigan.
Yeah.
And where are you? Are you like around Ann Arbor?
No, so okay, so how my practice works, I'm based in Pittsburgh, Pennsylvania, and I do everything virtually.
Oh, so you
Um,
can work with Michigan people though because you
Yep. So I'm licensed in 39 states to practice. So yeah. And so my like primary, I'd say offer that would be relevant to you all is I have a group therapy program. So it's similar to this in that there's a support element. It's all parents of autistic kids, but I would say that the additional layer is then, working through some of this clinical support. So each family, it is a group setting for families to learn from each other, but then also it's like you can come and say, hey, here's what's going on with my kid, what do I do? And I often really take a integration approach, right? So also thinking about like all these moving pieces, school, speech therapy, occupational therapy, ABA, what's everyone telling you? How do you integrate this seamlessly? And what that might look like is me coaching you on some of this and then also giving you kind of additive support strategies and clinical kind of supports for your child. But also I'll do some care coordination. So like I might reach out to your, speech therapist and say, hey, like this is what I'm noticing would be really helpful. I always take a neurodiversity affirming approach in what I do. And I will say a lot of providers haven't caught up with that yet, of really coming at it from a strengths based perspective while also supporting, those support needs. And so I'll do, care coordination like that. And then we have a group chat where families can get like unlimited support from me. So I'm in there once a day answering questions, helping to navigate and all of that. So my website is just drtaylorday.com. It's Dr. Taylor Day. And then I'm also two other things. I'm on Instagram. I share there pretty much daily. So it's the Dr. Tay with period. So the period Dr. period Tay. And then I also have a podcast. So I provide free resources there all the time. There's over 100 episodes, and it all is integrating this whole family approach where one day I might be talking or having a guest on talking about, clinical and therapeutic supports for your child, but then also making sure we're being mindful of all of this, so there's episodes on helping you as the parent to navigate this journey, as well as like, how do you talk to, if you have non-autistic children, how do you talk to them about, how their siblings' brain is wired and how their brain is wired and all of that, and how that's different and that there are different support needs. So yeah, so those are some of the ways.
I listened to the podcast. It's a good one, y'all, for like, whenever you're driving or doing whatever that you need some company in the background.
Yeah, it's called Evolve with Dr. Tay. Sorry, I forgot to say that. So
Perfect. Awesome. Meredith added it to her queue. She said, I guess my last question, and this is just me being selfish. I heard that Michigan, and that possibly in Michigan, the school was saying something about wanting Tegan to get reassessed because his autism diagnosis is out of state.
Okay, so here's what it is. So, and this is a really important thing. We have clinical diagnoses and we have educational classifications or educational diagnoses.
Okay, well, he got it from MUSC. What the heck? That should be enough.
It should, but here's the thing, the systems don't always talk. So your clinical diagnosis, what this is going to get you is access to outpatient services outside of the school systems, things like ABA. Sometimes it can get you like more speech therapy, more occupational therapy. It also can get you things like, different funding sources, grants, things like that. So that's the clinical diagnosis through the DSM-5. The educational system doesn't actually go based on the DSM-5. They have their educational criteria under the IDEA and to get an IEP. And so I see a lot of kids with low support needs. Not always, but those are usually more tricky cases. And I see a lot of disagreement where they'll have the clinical diagnosis, but they won't have the educational classification because school's saying, that's you. Okay. Yeah. Okay, Meredith. Yeah. Where school's saying, basically we don't have enough to justify an IEP, which is,
I will rip my hair out. I dare them.
I know. So what they're saying though, is that basically they're gonna, and every state has their own way of governing it. So what I'd recommend is bringing your MUSC assessment, sharing that with them, but they're going to redo everything to make sure he qualifies for an IEP in the state of Michigan. I will say,
I just worry because he is a lot further along than he was at 2 years old. So like
right.
if you look at his diagnosis paperwork, I'm telling you, it's like a whole new kid in the last 3. All this therapy has like done amazing things for him, but like I'm just nervous. It's obvious he flaps like crazy. He has meltdowns and he's aggressive if like things don't go his way. But if in a 5-minute meeting it can go unnoticed, and that scares me.
Well, no, it will be more thorough than that. They're going to do additional testing and all of that, but just make sure like they're going to also have you fill out questionnaires, make sure you're like really reporting all of that. But they'll do their whole evaluation again, most likely.
I was going to say too, I don't know, it's Texas, so it may be different, but ours was it was a pretty lengthy process where they actually had an evaluation with me there, but they also evaluated him at school over the course of several months with all of his different therapists and support teams.
Oh, we're fine then, because he'll be
I was gonna say it's not just like we're gonna look at him for a couple minutes and label on him yes or no.
And if he has like meltdowns and behaviors at school, then he's more likely to get an IEP because schools often have a pretty stereotypical presentation of autism, or they're thinking about how it's impeding the educational environment, whether it's other students or that student. And what we call externalizing behaviors, those more outward behaviors, are often easier to notice and then justify, the support needs. And they'll likely put like a BIP, a behavior intervention.
Yeah, that's what they're about to do right now at his current school, but we're moving, so it's going to take too many weeks. So we're starting it hopefully at the new school.
So you should be fine. But I mean, this is a very real thing of navigating those two different systems.
It's frustrating and it
I
makes me
know.
super overwhelmed.
I know. Yeah.
Well, anybody else got anything? Because we got 3 minutes before it shuts us off. I could talk real fast. I can get out like 5 questions in 3 minutes. Oh man. Well, I appreciate you,
Down
Dr.
under
Tay, for
pressure.
coming.
Yeah.
What?
Happy to do so.
I said I shut down under pressure. I'm sorry.
No, you're good. And yeah, Lisa and Jody, I saw your comments as well of like not having, not doing ABA yet and nobody's moving at the same speed. That's exactly it, right? Like you got to figure out for your family what's going to work. But I will say there's lots of different ways without adding too much pressure and burden on yourself. There's so many things that you can work on at home. And I think this is something that our system doesn't often talk about. They're like more therapy. Like, how can we get at the maximal amount of hours? And yes, there's circumstances that can be beneficial, but I'm a big believer too, and kids need time to be kids. Like, I think that is so important, whether that's, outings and you're slowly building up or just playing at home and all of that. They don't need full-time jobs right now. Like that's not how their brains are wired. And therapy is like a full-time job a lot of
Oh, it
times.
is. I was the mom that gave Tegan a full-time job, but luckily his brain is wired to love it. He loves busy
Good.
work. He loves
Yep.
now, if there's not a therapist here, he's begging me for one of them to come over. And I'm like, I'm good enough. Let's just, me and you.
Let's just hang out. Yeah. Yeah.
He's in that
But I'd
kid.
love to connect with you guys further. Like I said, Instagram is where I largely hang out. So if you guys are over there, and the podcast and all of it, and then if anyone wants to chat about what services could look like, just let me know here. I'll type all of it into.
Perfect. I can take a picture of
um,
that for you guys in the chat thread.
Love with Dr. So yeah.
Yeah.
But thank you for having me.
Thank you for coming. We appreciate you. Everybody have a good night.
Yes, it was so good seeing you all.
Take care, y'all.